Good morning, everyone. Thank you all for being here today. Thank you to my friend Kevin Savory and Kim Green from Green Savory Racing Promotions for joining us today, and to the city officials who are here with me today. We are ready to embrace the race here in St. Petersburg. And in fact, in just a few minutes, I'll be racing against some of my fellow mayors from around the region and the state. And I do need to make this clear. We'll be racing in a go-kart, not in Indy cars. The Mayor's Karting Challenge, as well as the Grand Prix of St. Petersburg, is now a tradition. And we again have the great honor of serving as the inaugural race for the IndyCar season. We do recognize, however, that this race is occurring at a time when many, including us, are concerned about COVID-19. As you know, the Florida Department of Health has reported more than a dozen positive cases in Florida thus far, and 2 lives have been lost. Last night, we received information that 2 cases had been reported in Pinellas County. Both of these individuals had traveled internationally recently. This morning, I was advised that these 2 have self-isolated and that their contact with others has been minimal, that our county remains in low risk, and that there has been no community spread. However, we also understand, given the limited testing to date, that this status and the data available is very fluid. As it relates to this race, attendees and residents of the city should know that we are taking every precaution we can to ensure it is a safe experience. Now, I'll let Mr. Savory and our emergency management manager, Amber Boulding, speak to that in a moment. As mayor, I want our residents and our visitors to this city to go about enjoying their lives, but do so using common sense. We can allow for this disruption without interruption. And that means practicing good hygiene, washing your hands, covering your mouth and nose with a tissue when you cough or sneeze, and avoiding close contact with others who are sick. It also means staying home if you're in one of the high-risk categories, if you're not feeling well, or if you're showing any symptoms. So let me reiterate this point in particular. If you don't feel well, please stay home and watch the race on NBC Sports Network. You'll still see the race, and you can see how beautiful we look on TV. And if you recently traveled to China, Iran, Italy, or South Korea, you should be isolating yourself anyhow. It is incumbent on all of us to be mindful of our own health and respectful of others. Residents should continue to monitor all reputable sources for information, educate others, spread calm, not fear, and know that smart scientists and public health professionals are working hard every day to make the coronavirus short-lived. And finally, if you'd like to sign up for emergency alerts from the city of St. Petersburg, please visit stpete.org/alert-St. It is free for residents and allows us to communicate directly with residents during emergency situations. And so with that, I'm going to ask Mr. Savory to make some comments. Kevin?
Thank you, Mayor. Good morning, everyone. Welcome to the 16th Annual Firestone Grand Prix of St. Petersburg. Obviously, these are times when teams are really tested, and I have every confidence in our team at Green Savory, and obviously in Mayor Kriseman's team here in the city of St. Petersburg. We've taken extraordinary steps this year by, we've always had hand washing stations. We've added additional hand washing stations. Our partners there did a great job bringing that up. We've also added hand sanitizing stations. They'll be throughout the racetrack as well. And we've added 2 hand washing trailers that are multifaceted units. So we're taking a lot of steps to make sure, number 1, wash your hands with water and soap. So it's going to be here. Please use it. The second thing, obviously, is if you're not by one of those hand washing stations, use one of the hand sanitizing stations. And I think the mayor hit every point. We just remind all of our fans and spectators to please pay attention to the CDC, to pay attention to florida.gov-COVID-19. That website's updated by Florida often, and the last update was about 11:45 last night. So again, it's good data. Within that data, it tells you the other precautions to take. Obviously, the self-isolation, in discussion with Mark Miles, I know he's actually reaching out to IndyCar and their teams and everyone to basically confirm anything about any international travel within that 14-day period. So even IndyCar has taken that steps with its teams and participants to confirm that. So again, I think we're going to provide, I know we're going to provide a safe environment for a great race, and looking forward to crowning a champion on Sunday about 5:30, and I hope everybody comes out to watch it because they're going to put on a hell of a show. So thanks very much.
Thank you, Kevin. And now I'd like Amber Boulding to give an overview of our emergency plan. Amber?
Good morning. So when we're preparing for any event, any hazard, coordination and collaboration is absolutely key. And when dealing with an infectious disease, it's no different. We have to work with our community partners. So with that, the city's been working really closely with the Florida Department of Health here in Pinellas County, as well as with our Pinellas County partners, and following the guidance that's been given to us through DOH and through the CDC. And one of those guidance documents is guidance for mass gathering. So we've taken that and we've really operationalized it to fit our city. So with that, the purpose of the document is to outline the key planning considerations in the context of COVID-19. The plan is a multi-layered strategy and includes a public education component at the event, as well as encouraging good hygiene practices and the procedures for our public safety team, fire rescue, and police to follow if an event participant is exhibiting any signs of COVID-19. It's important to note, as part of this mitigation strategy, we encourage anyone, again, as Mayor said, who is ill not to attend the event. If you're at the event and you begin to feel ill, we encourage you to take all the appropriate precautions, good hygiene, cover sneezes and coughs, and go ahead and leave the event and head home and call your doctor or the health department if that's the case. Again, it's meant to be a fun event. If everyone does their part, practice good hand hygiene, covering coughs and sneezes, stay home if you're sick, we're hopeful and confident that we'll have a great outcome. And we're prepared for any eventuality or consequence that may pop up during the event. We'll be running full emergency operations, communicating with our partners at all times. We have a solid plan and a contingency plan. Thank you.
Thank you, Amber. With that, we'll close the presser, and if there's any questions, we're happy to try and entertain them.
A lot of people have canceled events because, just for precautionary reasons, a lot of them in low-risk areas too. What was the main factor you guys used to decide, hey, we're going to go no matter what?
So, as I said in my remarks, this is really a balance, and public health and the safety of our community are always priority number one. But we also need to make sure that we're not panicking. We need to go about our lives, at least until we have data that suggests otherwise. We are in constant contact with CDC, Florida Department of Health, Pinellas County. We are at low risk. We are not having in a situation where there is community spread. Those are very important factors. If those factors changed, we would be sitting down again with those partners, the CDC, Department of Health, and the county, and we'd be reevaluating at that point in time. But I can't stress this enough, and I'm going to keep saying it over and over again. If you're not feeling well, please don't come to the race. Watch it on television. We need to take responsibility. We need to self-isolate if possible, and we need to use common sense.
Does this event mostly draw a local crowd, a regional crowd, or an international crowd? Does that play a factor?
It's substantially a regional crowd within 75 miles.
How about the drivers?
There are foreign drivers, but again, they've been in the country in excess of the 14 days.
Mayor, you said this is the very We're Wednesday, and things don't start up till Friday, Saturday. How could we navigate this if things would unfortunately get worse before they get better?
So I've been on the phone every day, as I know Amber is, with the Director of Health for the county. We're in constant contact with the Department of Health for the state and with the CDC. And it's really, we're trying to be data and science-based in our decision-making. I think that's really important, that we're relying on good science and good data in making those decisions. If something were to change, then we will sit down with those folks and make decisions based on the data and the science that they share with us, and act accordingly. But at this point in time, we're at low risk. We're not at community spread, and so we are still a go for Sunday.
Mayor, what was your reaction when you heard about the two positive cases?
Certainly, you feel your heart goes out to those two cases, you know, and the hope is that they have a good recovery from this. You know, it was, for me, I wanted to know, I had several questions when I heard about the two cases. Is one, did they have contact with a lot of individuals? In speaking with the Department of Health today, my understanding is they did not. It was very limited. Question number two is does it change our risk factor from low to high risk? The answer was no, it did not. And the third question is are we seeing community spread? And the answer was, at this point, we are not. And so, you know, your first thought is for the individuals, and second thought is what's the impact of that? What's the science and the data telling us at this point in time?
And my other question would be, what kind of concerns do you have? There's been limited testing, the ability to test in large numbers. What kind of concerns do you have that maybe just as a community we don't know what's out there?
I mean, it's obviously fluid, and that was my comments. Is that we are monitoring this not even daily, but you know, basically hourly, and so you always have those concerns. But it's again about trying to strike that balance and rely on what we're learning and what we're being told from the CDC, from the Department of Health for the state, and from the county. Those are the best sources of information for us to rely on, and we're going to continue to rely on them and be in constant contact with them.
And Mayor, looking beyond this weekend, I mean, St. Petersburg is a very welcoming city, and we get an international crowd that comes here and visits. Concerned that attraction can also be a problem, a challenge for us in the long run. Dealing with coronavirus.
Certainly, I mean, I think the state and the federal government have taken some steps related to international travel, especially if you're coming from China, from Iran, Italy, or South Korea. And you know, for anyone that's traveling into the country from those countries, there's already an isolation policy that's in place. So, you know, again, all we can do is rely on the experts and on the science that we have available to us in making the decisions that we make. And, you know, before this event even happened, if you've ever heard me speak before, you know that we always talk about how in St. Petersburg we believe in science, whether it's climate science or it's medical science and life sciences. It's something we take very seriously in the city of St. Petersburg, and we certainly look to the experts.
Have there been any serious conversations about having the event without spectators? What sort of insurance do you guys have with this?
Kevin?
Could you repeat the question?
Yeah. Well, have there been serious conversations about having the event without spectators? And what sort of insurance do you all have?
So the last part of the question, there is no insurance, and if you try to acquire that once a virus starts, it's going to be impossible, whether it's us or any other sporting property. And there's been no conversations at all about, other than the 16th annual Firestone Grand Prix is on, and if that situation changes, then we'll deal with it.
The emergency management team talked about having a multi-layered strategy. Can you delve into some of those layers?
So with it, communication's always going to be a key component, and it's not just communication within, you know, the race network. It's with all of our community partners, because we all have a stake with the race. So it's not just city, it's county, region, state. So making sure we have those tight communication plans and risk communication on how we're going to talk to people and when and at what point in time and the different decision-making thresholds that we have. With the communication, it's also the public education component. So communicating with the community, with the event participants that are going to be coming, with event staff, making sure that they're also, following the guidelines that we've set forth to be safe and to run a safe event. And just, looking at all we call it consequence management. So what could happen and what are we going to do if that happens? And that's not just with COVID-19. With a big event like this, there's always different considerations. So it's with the multi-layered strategy, it's looking at all hazards and all risks and doing that risk assessment to see, what could happen at this event and what are we going to do if it does, and aligning all of those, strategies up and the procedures that are going to happen and the partners that will be involved, and including that in our overall plan and the risk communication plan, so we know who to call and when.
All right, thank you all so much for coming today. I know we've got another kickoff in about 15 minutes, I guess.
Ready to go?
Yeah, in about 15 minutes, so hang tight. Thank you all for being here.
Thank you.
Good job.